Hello, I'm going to discuss how to teach a patient how to do a self-breast exam. So first I'm going to walk into the room. I will introduce myself to the patient. I'll have the patient state their name and date of birth. Then I will look at their wristband to confirm that is who they are. Then we'll get started. So I am going to be explaining to the patient today that doing a self-breast exam is very important to use the correct technique and learn the correct technique of how to do a self-breast exam to help discriminate between benign or malignant tumors that could come up. And learning this and presenting this is the first detection of breast disease. Also, a lot of the self-detected masses or breast pain are found by the patient. So we'll go ahead and get started. I'm going to wash my hands for the patient's safety. I will not put on gloves because it's best to do a breast exam with no gloves on, so you can better feel for the masses. I will let the patient cover the patient up as much as I can, just and expose the area that I need to expose at that time. So getting started, I am going to first talk about how just looking, like making sure everything looks right. So the inspection part of the breast exam. So I'll have the patient just sit on top of the table, straight ahead, and I'm just looking for like symmetric. I'm looking for color, texture, nipple discharge. I'm going to have the patient raise their hands over their head, and we're going to be looking for the exact same things. If that is fine, I'm going to have the patient go ahead and lay down on the exam bed, and then I'm going to have them lift one arm over their head and go ahead and start palpating, do the palpitation part of the breast exam. So I'm going to do a circular motion. So I'm just going to start at the top, upper left quadrant underneath the armpit, and I'm going to work my way around in circular motions all the way until I can get to the nipple in that circular motion. So I'm feeling for hardening. I'm feeling for any abnormal lumps, or if the patient feels like that lump has changed in any form, the texture of it, the color of their skin again, and making sure there's no discharge at that time. Once I'm done with that, we will have the patient sit back up and explain to them, once they're done with that self-breast exam, or to do that every single month, and it's best to do it after their menstrual cycle. So that way, what is tender during your menstrual cycle or before your menstrual cycle is less tender after. So it's best to do it then to be able to determine if these masses or tumors, benign or malignant, have changed in size. Then after I'm done with that, I would ask the patient if they have any questions. Feel free to demonstrate themselves so we can watch them and make sure they are doing it correctly and educate further. And then I would wash my hands and leave the room. Thank you.